We're just 12 hours away now from the city losing a major healthcare resource. WellStar plans to close Atlanta Medical Center at midnight. It's already putting a strain on other hospitals. 11 Alive's Karis Belger has a look at new steps Grady is taking to take care of some of the pressure mounting on its emergency room.
Right now, almost every hospital is overflowing. And so if you go to an ER, you are going to wait a longer time, particularly if you don't have a true emergency.
Grady's chief medical officer, Dr. Robert Jansen, says his hospital is trying to find ways to tamp down on ER wait times.
Putting in place a system where people can call in advance and maybe be routed to a different location other than the emergency room. So it's kind of like a nurse advice line.
Jansen says this is partially in response to the influx of ER patients that have come into Grady Memorial Hospital as a result of Atlanta Medical Center's closing.
We have seen an increase in volume. But one of the things that we know is that a lot of patients who come to emergency rooms don't really need to be there. And there are alternatives.
The idea is to have people call ahead instead of just heading straight to the ER. After hearing their symptoms, a staffer can instruct a patient to either come to the emergency room or go somewhere else, like the walk-in center next door. For example, Jansen says a sore throat, a common cold, or a small cut can be handled in urgent care. If you're bleeding or experiencing some other severe symptoms, that's when he says you should come to the ER. He says the hotline should be up and running in the coming weeks, but in the meantime, staff at the hospital are preparing to continue treating everyone they can.
We're opening up additional slots in some of our primary care offices so that we can direct people there if they call in.
Karis Belger, 11 Alive News.